Session. Welcome, sir.
In the previous session, we had discussed about the features of Vataja, Pittaja, Kafaja, Jvara. The next part is about the Dhatu Gata Jvara. Now, this again a unique concept of Ayurvedic principle. Like the severity of the Jvara condition is assessed by involvement of the different dhatus. And the clinical symptoms is all assessed on based upon the clinical symptoms and really the investigations. Now, the clinical features of the Rasagata Jvara would be Guruta, Hridayatkleshah, Sadaram, Chhardi, Arojiko, Rasasthetu Jvarelingam, Dainyam Asya Upajayate. The heaviness in the body and maybe palpitation and the general debility, vomiting and anorexia. These are the clinical symptoms of Rasagata Jvara. Now, this is one of the unique clinical presentation of any febrile illness. Whenever, as we have discussed about that pathology of the fever, once there is a need for defending the body tries to conserve the energy and direct the energy to the fighting with the disease. And as we have discussed earlier, the major amount of the energy is required for the digestion of the food which you have consumed. So, one of the basic issue of conservation of the energy is reduce the food intake by producing that anorexia-like symptoms or gastrointestinal tract symptoms. So, it's a very common feature, like whenever you have a febrile illness, the first of the symptoms which would occur would be anorexia, irregular appetite or occasionally vomiting and a general debility, total reduced physical activity. To make you to have that lesser physical activity, the muscles would be producing that sensation of heaviness, reduced activity. Then the next is if there is involvement of the Rakta Dhatu in the next level, Rakta Nishchivanam Dahaha, Chvedaha, Chardana Vibhramo, Pralapaha, Pitika Krishna, Rakta Prapte Jvaren Ran. When there is involvement of the Rakta, the next level of febrile illness, there could be hematemesis or burning sensation, excess of sweating, even vomiting can occur, giddiness can occur. Occasionally there could be even this irrelevant talk or eruptions over the surface of the body, excess of thirst would occur. Now, as from the current point of view, you do not have that kind of a concept like involvement of the blood in case of the febrile illness. But the other way we can look at it, what we look at it is the changes which you can see in the blood. Whenever a patient has a febrile illness, one of the usual investigations which we do would be peripheral leukocyte count and the common features in case of infective disorders, particularly febrile illness produced due to infective pathology. There would be a significant change in the WBC count, and the pattern which you could see would be in the bacterial infections there will be polymorphonuclear leukocytosis, total count would be increased, whereas lymphocytes would be increased in case of the immunological conditions or chronic granulomatous like conditions like tuberculosis. Then eosinophils usually are raised in allergic manifestations, and specific morphological changes can occur in leukemia. In leukemia, different sorts of the leukemia, either lymphoblastic or myeloblastic leukemia, the specific type cells we may change that shape. A leukocytopenia, reduced count, could be sign of either in a very advanced conditions of the septicemia, which will come to that point of view, or it could also be occasionally seen in certain specific fevers like typhoid, where there could be some cytotoxic substances released. Another of the common feature which we see in case of all febrile illness would be elevated C-reactive protein or CRP being raised, which is a sign of inflammation. Similarly, ESR also tends to be raised in all cases of febrile illness. Both of these would be suggestive of an inflammatory changes in the body, and it's always related to the cytokine release. So, if you have to have a very advanced investigation, the cytokines and interleukins could be assessed. A relatively simpler investigation to assess the level of inflammation could be CRP and ESR. Platelet count may be reduced in case of specific conditions like dengue or certain advanced leukemia conditions. Then Another of the consequence of any febrile illness on the blood concentration would be fluid loss, electrolyte imbalances can occur, and the circulation becomes hyperdynamic. That's the common feature in any case of febrile illness. Now, when I say this, I don't mean to say that this is equivalent to the Raktagata Jvara, but a parallel issue, this perception in the contemporary science, it doesn't suggest about the involvement of the Rakta as such, but one of the usual parameters which are used to assess the severity as well as the prognosis in case of the febrile illness investigation. So from that point of view, maybe it's a parallel view. I am not saying that this is a sign of Raktadrushtigata Jvara. Then in case of the Mamsaga, Pindikogbeshnam Krishna System Jvarapratishedha Ushma Antardaha Vikshepo Glanihi Syat Mamsage Jvare. In case of Mamsagata Jvara, that's the involvement of the further soft tissues, muscles and adipose tissues and so on. There could be cramps in the muscles and excess of thrust. There could be even excess of discharges of urine and fecal contents. Then the temperature would be presented as Antardaha. The core temperature tends to rise much more than the peripheral temperature, and this core temperature being raised also is a sign of septicemia. Glanihi, there would be very severe distress. These are the signs of Mamsagata Jvara. Bhrisham Swedaha, Trisha, Murcha, Pralapaha, Chardiravaja, Daurgandhya, Arochiko Glanihi, Medastrecha Associated Medogata Jvara, there could be rapid excess of sweating and excess of thirst, even impaired consciousness, even delirium could occur, vomiting, and there could be foul smell around the area. Arochaka, there's anorexia is a common feature. These are signs of Medogata Jvara. In case of Astigata Jvara, Bhedo Asnam, Kunjanam, Shwasaha, Virekaha, Chardiravaja, Vikshepadam Chagatranam, Etat Astigate Jvare. Astigata Jvara, there could be even disruption of the content of the bone. Then Kunjanam, there could be a difficulty in walking, and hence the patient may have an altered gait, breathlessness, even diarrhea or vomiting can occur, and there could be even involuntary movements. Now, again, as we have already referred to, I am not suggesting that this is a issue which can be compared, but from the current point of view, whenever a patient has a febrile illness, irrespective of the cause, there could be certain common changes which could be seen in the muscles and adipose tissue. And these features are not suggestive of either Mamsagata or Medogata or Astigata Jvara, but these changes are seen and hence there is some parallel activity. And one of the important changes which we see in case of the muscles, any febrile illness, once the body temperature rises, there will be an increased catabolic activity in the muscles, and one of the evidence of that increased catabolic activity would be the lactate level increases as much as 17% during exercise, as well as almost after the infection, it may again increase much more than that, and it may take up to about 50 weeks before returning to normal levels. And that's why in any case of febrile illness, a rest is suggested. Activity of the muscles have to be reduced so that the possibility of accumulation of the lactate levels would be reduced. A significant increase in the lactate level can add to the acidosis. The pH in the blood could be reduced and acidosis could occur, and this may be significant in certain toxic conditions or in ICU conditions. But routinely in common febrile illness, it may not be just seen. So assessment of the lactate in case of any febrile illness is not a routine investigation, but if at all you are having certain specific issues where there is an acute muscle pain, this could be one of the parameters to assess the catabolic activity in the muscle, and the remedy for that would be rest as such, reduced physical activity. Then another of the changes which could be seen in the muscles would be cytokine induced muscle protein loss could occur, and this can result in wasting of muscles, particularly seen in certain conditions like chikungunya. Post chikungunya, many of the patients may have the atrophy of the muscle seen, which could be due to the protein loss as such. Then brown adipose tissue metabolism is one of the mechanism of fever. Every fever illness, that's something which you have discussed in the first session about the fever. There would be abnormality of the mechanism of the adipose tissue, physiology of the adipose tissue, which is called as brown adipose tissue, and that's one of the mechanisms by which the heat is conserved in the body, and hence there would be certain changes in the fat tissue. Now, when I refer to this, again I have to repeatedly clarify, I am not suggesting that these are the signs of Medogata or Mamsagata Jvara, but I am just saying that there is a parallel view from the current side also. Then in any patients with the high temperature, once the body temperature increases, there will be a change in the glomerular filtration rate. The glomerular filtration rate reduces after every 2 degrees centigrade temperature by significantly, and if the temperature rises beyond that, it reduces further, and it can result in possibility of either increased creatinine level, urea level, or maybe even the other permanent changes in the kidney also can occur, though not routinely. And this is one of the features which we discuss later on when we go into the multi-organ failure. Then brain also, there could be some changes in the brain which is called as or which can result in a abnormality of the blood-brain barrier. In any febrile illness patient, the blood-brain barrier would not be as effective as normal, and hence many of the toxic substances which otherwise may not reach to the brain may reach to the brain. These are essential when you administer certain drugs which can cross the blood-brain barrier, like sedatives, tranquilizers, and so on. In a patient with febrile illness, if necessary, the dose has to be modified because the impact of these drugs in a febrile patient would be much higher than the others. In the liver also, transaminase level tends to rise, particularly in case of hepatitis conditions. Moreover, in many of the patients of febrile illness, a moderate rise in the transaminase level can occur due to administration of acetaminophen. Acetaminophen, the paracetamol like drugs also can increase the liver transaminase level as such. Then the further would be Tamah praveshanam hikka kasas shaityam mamisada antardaho mahashwasah marmachedascha madhyage. In the madhyagata vyadhi, jvara, there could be these a blackout like symptoms. Patient may faint, and that fainting could be occurring as the symptoms like Tamah praveshanam. Hiccup could occur, cough, and a feeling of coldness, vomiting. Again, antardaha is a common feature in any gambhira jvara, and the breathlessness could occur, and marmacheda, vitality of the patient could be reduced. The vital signs could tend to get altered. Maranam prapniyatatra shukrasthanagate jvare, there could be even fatal complications in case of shukragata jvara. In addition to this, the symptoms related to the sexual activity could be presented. Shefasa, stardhata, moksha, sukrasha visheshadaha, daktya indanam yatha vanhi dhatun hatva tatha visham kritakritya vrajechanti deham hatva tatha jvaraha. Even there could be sexual changes in case of the shukragata jvara, but more important is it can be fatal, very severe. That's a multi-organ failure symptoms could occur. Now, there is a comparison like as a poison would be producing the damage to the tissues, or it like a fire which burns by using all the fuel, and then once the fuel is over, it burns out whatever that, even the raw substances could be burned out. Similarly, the fever can result in a fatal complications. Of course, now as far as the current situations are concerned, fever and bone marrow, there is no specific issue, but in certain disease conditions like patients of typhoid fever, more than half of the monocytes have infiltrated into the bone marrow, at 16% of lymphocytic infiltration. Though routinely we don't go for the bone marrow study in typhoid, the peripheral leukocyte count tends to be reduced, and there will be impact on the bone marrow. In very specific cases, you may do that. And Even there could be amyloid deposits and around the blood vessels in the bone marrow in chronic febrile illness, any other febrile illness. Even in certain neoplastic conditions, leukemia-like conditions, the bone marrow changes are quite characteristic. Then any toxic pathology can present in a situation called as a multiple organ dysfunction syndrome or multiple organ failure. Now, multiple organ dysfunction syndrome or multiple organ failure now is defined as a development of potentially reversible physiological derangement involving two or more organ systems not involved in the disorder that resulted in ICU admission and arising in the wake of potentially life-threatening physiological insult. Any disease, it can occur in any disease, which results in an extension of the disease into some other system for which the patient was not initiated with the treatment. Causes could be anything. Causes could be as a consequence of the disease, or it could be a consequence of the treatment, or consequence of the improper treatment, and so on, whatever it is. When there is more than one system involved, then it could be considered as a multi-organ failure, and majority of the severe febrile illness patients, particularly infective conditions, can result in multi-organ failure symptoms. Multi-organ failure signs could be, as in case of central nervous system altered consciousness, respiratory system hypoxia, and hepatic system jaundice, and cardiovascular system tachycardia or bradycardia, hypotension, and renal system oliguria and raised creatinine level. Hematological system platelet count, WBC is reduced, D-dimer level could be increased, and disseminated intravascular coagulation can occur. Now, a comparison of the Uttara Dhatu Jvara from Rasa to the Shukra, that can be to a certain extent compared to the evolution of the multi-organ dysfunction syndromes in any patient of toxic pathology. Then Vatapitta Kapothanam Jvaranam Lakshanam तथा तेषां भिषक् ब्रूयात् रसादिष्वपि बुद्धिमान् समस्तेः सन्निपातेन धातुस्थम् अपि निर्दिशेत् द्वन्द्वजं द्वन्द्वजैरेव दोषैश्चापि वदेत् कृतम्. Whenever you treat a jvara or assess a jvara, it's not enough if you assess only the doshas. Vata pitta kapha lakshanas are to be assessed. At the same time, the severity of the jvara has to be assessed based upon the dhatugata lakshanas. Gambhira or Uttana dhatus. Rasarakta, they may be considered as Uttana. When it goes beyond that Mamsa Majja, then it becomes Gambhira. That would predict the prognosis. And the clinical features of Dvandvaja, when more than one doshas are involved, that kind of symptoms also have to be assessed. So the assessment of a febrile patient would be in two ways. One, assessment of the doshas involved in that condition. The other would be assessment of the dhatu which is involved, and this has to be a dynamic assessment, that you have to assess the patient every time you visit the patient and assess the changes which can occur in the course of the disease and plan the management accordingly. Now, Gambhirastu Jarojnyeha Antardahena Tusnaya Anadtena Chatyartham Shasakasodgamyena Cha. The general evidence of a Gambhira Jvara or a severe Jvara would be when there is Antardaha. Antardaha is when the core temperature is much higher than the peripheral temperature. Even in the normal condition, core temperature is higher, but in a case of febrile illness, the core temperature may be very much high. The peripheral temperature either may less than normal or may be nearing normal. In such conditions, it is a sign of toxemia, a failure of the body responses. That's the evidence of Gambhira Jvara. And Trishna, excess of thirst and distension of the abdomen or breathlessness and cough also can be evidence of a Gambhira Jvara. A patient of fever during the treatment, if he develops any of these new symptoms, then it has to be considered as a severe condition. It's absolutely true. The same would be the approach even now. Hatha prabhendriyam kshiram rochaka nipitam gambhira tikshna vegartam jvaritam parivarjayet. A patient who has a impaired vital functions, Hatha prabha is a impaired vital functions, reflexes are reduced, and the sensory organs are not able to function properly, and a patient who is very much emaciated and who has a severe anorexia, and the evidence of the fever suggests about involvement of the deeper or higher levels of the dhatus or severe signs are there, such conditions are considered as varjya, they cannot be treated. हीनमध्यादिकैः दोषैः त्रिसप्तद्वादशाहिकः ज्वरवेगो भवेत् तीव्रः यथा पूर्वं सुखक्रियः. Depending upon the severity of the doshas, the duration of the fever, duration of the jvara also can be either 3 days or 7 days or 12 days. And those jvaras which are relieved or resolved within shorter duration like 3 days is having a better prognosis and the treatment is easier. Longer the duration, the prognosis is poor and the treatment also becomes difficult. Kalohi esha yamashaiva niyatihi mrityirevaja तस्मिन् व्यपगते देहात् जन्म इह पुनरुच्यते इति ज्वरः समाख्यातः कर्म इदानीं प्रवक्ष्यते. And this duration of the jvara is one of the important issue in case of any of febrile illness. And in case of febrile illness, if you do not follow these or if the patient doesn't get cured or relieved with this kind of this duration, then that's a sign that the prognosis is poor. Now, in the present day situation, the major complication of the febrile illness or toxic pathologies, septic pathologies, infective conditions would be septicemia. Septicemia is a relatively older concept, word, whereas the current term is systemic inflammatory response syndrome or SIRS is one of the new term which replaces septicemia. Of course, when we are studying, the septicemia was a common word, even now we do use that word, but the current 2016 American College of Chest Physicians and Society has replaced that term with the SIRS, that's Systemic Inflammatory Response Syndrome, and it's an attempt to describe the clinical manifestations that result from the systemic response to infection. Now, it's exactly that assessment of systemic response to infection is the assessment of the dhatus, involvement of the dhatus. Maybe the terms are different, language is different, but the assessment is almost similar. Earlier definition was septicemia was defined as a state of microbial infection from a portal of entry into the bloodstream which causes sign of illness. And it suggests of either changes in the physiology of body as well as endothelial vessels. Now, sepsis as such is defined now in the current terminology as a life-threatening organ dysfunction due to dysregulated host response to infection, and organ dysfunction is defined as an acute change in the total systemic organ function assessment score of 2 points or greater. Now, that SOFA score assessment of the sepsis-related organ failure assessment is one of the important criteria which is now followed, and it gives you the ratio or maybe a numeric value of the possibility as such. Now, a parallel to assessment of the Dhatugata Jvara is the SOFA, sepsis related organ failure assessment. Now, the current approach is based upon the target of the specific organs, whereas in Sushruta it's related to from aggregates, not only Sushruta, in both Charaka, Sushruta, Bhagavata. The assessment will be based upon the issue of involvement of the dhatus. The present criteria of assessment of the sepsis related organ failure assessment is also would be assess the respiration. In the respiration again, PaO2 divided by the fluid pressure in the mercury. If that ratio is more than 400, more than 400, then it is considered as normal. If it is less than 400 and in between 220 to 301, grade 1, 142 to 20 is grade 2, 67 to 141 is grade 3, and of course this data can be assessed by pulse oximeter, the assessment of the peripheral oxygen as well as the blood pressure ratio, systolic blood pressure ratio would be the criteria. Then coagulation time, platelets, counting the platelets, depending upon the count of platelets, if it's more than 150,000, then it's considered as a normal, that's 1.5 lakhs. Then if it is less than 20,000, that's grade 4. Similarly, bilirubin level assessment, the normal, and if it is raised by 12, it's around signs of involvement of the liver. Cardiovascular tension, arterial tension would be assessed by peripheral arterial pressure, if that's pulse pressure. If it is less than 70, more than 70 millimeters, is considered normal. If it is less than 70 mm, and if the patients respond to dopamine, if the dopamine produces a response in the smaller doses, then if 5 units of dopamine is enough, then it's considered as grade 2. If the dopamine dose required is more than 15 units, then it's considered as a grade 4. Or the other drugs like epinephrine, norepinephrine, which are used, and these are criteria used in the ICU setup. Then if the nervous system control, if the patient has a Glasgow Coma scale, and the Glasgow Coma scale is assessed if it is 15 normal, whereas less than 6 is critical, and this of course we have discussed about this Glasgow Coma scale earlier. Creatinine level, which also is a criteria, less than 1.2 is normal. If it is more than 5, that's a sign of grade 4. So based upon that, the criteria are assessed. Now, the pathology of sepsis and multi-organ failure now is described as the changes which occur in the macrophage and the tumor necrotic factors, which is regulated by the hypothalamus. In the normal, in the moderate level, it results in hypothalamus, fever, and the usual response, febrile response. If the tumor necrotic factors and the cytokines are more than this higher level, then it can assess the it can involve the capillary endothelial cell, and there could be the changes in the platelet adherence, which can result in the cellular hypoxia and the multi-organ failure, even death can occur. Or when it accesses the nitric vessel wall, there is a possibility of nitric oxide synthesis, which also can result in vasodilatation, and that's how the pathology is seen. In a patient with the neutropenia, if the total WBC count is reduced in a case of febrile illness, in case of typhoid, of course, it is one of the issue. Other than that, if you have a suspicion or proof of infection, that's a sign of severe sepsis, and in such conditions, you have to provide enough of adequate and fluid condition, vasopressors are given, and if even the response is lesser, then it could be considered as septic shock. This is another way of assessing. So instead of going for the grading, another way of assessing a practical clinical issue is if the leukocyte count is reduced in a patient with febrile illness, then that's a sign of a possibility of a septic shock, and the septic shock has to be managed energetically. That's about the usual principles of the treatment which are followed now. Then that's about the assessment of the Jvara. The next part is about the treatment of the Jvara. ज्वरस्य पूर्वरूपेषु वर्तमानेषु बुद्धिमान् पायेत घृतं स्वच्छं ततः सलभते सुखं विधिः मार्तजश्वेषः पैत्तिकेषु विरेचनं मृदु प्रच्छर्दनं तद्वत् कफजेषु विधीयते. Once the Pururupa Lakshanas of Jvara occur, in case of Vataja Jvara, a Acha Gritapana is suggested. In Pittaja Jvara Lakshanas, Mrudu Virechana can be given, and Kapaja Jvara Lakshana, Vamana can be given. But this is in the Pururupa, in the early stages. Sarva Dvidoshajeshu Uktam Yatha Dosham Kalpeta. It can be considered, the combinations of these protocols of the treatment can be considered based upon the Dosha Lakshanas. Asnehaniyo Ashodhyascha Samyak Jolanganadina. If the Snehana and Shodhana cannot be done, in that condition, Langhana is the most preferable treatment. So, in the practical situations in the current practice, the possibility of a Shodhana before the Jvara would be fairly lesser. Reasons are many. But in such conditions, Langhana is the primary line of the treatment. Rupa Pragrupayoho Vidyata Nanatvam Vanidhumavata. The clinical features can be varying significantly, and they are very dynamic changes, and it's as dynamic as a fever, this fire and the smoke. Fire and the smoke, it changes the shape, changes the quantity, so on very rapidly. Similarly, the lakshanas, the signs and the symptoms of the Jvara can change rapidly, and hence instead of going for the shodhana, which is very difficult to assess, pravyakta rupe shitam ekantena apadarpanam. Once the lakshanas are seen, then the only possible treatment is apadarpana. Shodhana has to be done only in the Pururupa, but once the clinical signs are established, then apadarpana is the line of treatment. And no specific medical treatment is suggested. That's one of the important. Kashaya rasa dravyas are not to be given. Drugs which can suppress the fever also should not be given. This is what Ayurvedic principle would say. All samhitas, Charaka Samhita, Sushruta, all suggest about the same. And practically, is it ever possible? This is the question. In the present day situation, every patient, every person, every even a illiterate person knows about paracetamol. And a patient having when a slight fever, the first day he takes some dolo, and every patient coming to us would be having taken dolo, and then with that complications would occur. But from the current methodical pharmacological point of view, whether this is justified or not, it's not justified. And the standard lines, of course, if you look at the literature, medical literature, there is a group of, there is a significant difference of opinion among the two groups of the people. One stronger group is about suggesting about the antipyretics. Antipyretics will suppress the fever, their benefits are just counted a lot. But there is another significant group, a well-learned group of clinicians who suggest about the benefits of not giving antipyretics, but only suggesting about the diet and the rest as the basis of the treatment. And these benefits and these advantages of allowing the fever in the sense without giving any antipyretic drugs would be considered. And one of the important article, I have just copied it from one of the important article, which suggests about that advantages of allowing fever. And these articles are not from any parallel medicine system, it is from the contemporary modern medical system that I have just copied this. The function advantages are the same. When you do not give an antipyretic drug, the heat stimulates the immune functions and heat directly inhibits the pathogens, harmful pathogens, and likely synergy of immune stimulation and heat harming pathogens can occur. And fever is another advantage would be if the patient is given rest and he is prevented from moving around, he will not spread the disease to others. Chances of that febrile cause sickness involving the others would be lesser because of the reduced social contact. Of course, cost may be slightly higher when you do not use a antipyretic drug. Giving an antipyretic drug makes the patient mobilized. Now, even one of the very important reference which I would suggest all of you to read would be, reference is here, it's from the Journal of Thoracic Diseases, where a very practical trial, I have just copied it from that, one sentence from that article. Those who are interested, they may go through the whole article as such. 700 ICU patients with the fever of known or suspected infectious etiology were randomized to receive either 1 gram of intravenous acetaminophen or placebo every 6 hours until ICU discharge, and resolution of fever, cessation of antimicrobial therapy or death, and so on. So either the patient is discharged or till the fever is resolved, or if the patient till he dies. Now, the observation which was seen at a gap of 28 and 90 days mortality, and statistically it was analyzed, and it showed not significantly different between the two groups. This is an important issue, and it's not a simple one or two patients. 700 ICU patients are tried in a very classical method, and it's a publication in a very reputed journal, and very eye-opening, like the use of such antipyretics which may reduce the temperature temporarily may not have any advantage in the long term. That's the important issue. Now, then the other principle would be Amasheste doshetu Sutklesha Vamanam Param आनद्धः स्तिमितैः दोषैः यावन्तं कालमातुरः कुर्याद् अनशनं तावत् ततः संसर्गम् आचरेत्. If the doshas are accumulated in the amasya and the patient has more of salivation or nausea-like condition, then vamana is suggested. And if there is only a distension of the abdomen, flatulence, then the patient should be kept fasting, anashanam. The fasting should be done till he develops the appetite. Never give excess of food in the case of febrile illness. The febrile illness patients have to be given light, easily digestible food, or the fasting is one of the advantages. Even related to the fasting, lots of articles are published. I will just refer to a few of them later. And that is one of the important issue. Nalanghet marutaje kshayate manase tadha alangheshchapi ye purvam divraniye prakirtitaha. The langhana should not be done in case of vataja jvara, in case of kshayaja and manasa jvara, psychological illness presenting with the jvara, or any other alanghyaha where the prevention or avoidance of the langhana is suggested. In such conditions langhana should be done, but otherwise langhana should not be done. Otherwise, in all the patients, langhana is one of the better course of the treatment. Without giving any other medicines, patient has to be given light food, rest. That would be the better treatment. And only when the patient has a severe utklesha, nausea-like conditions, vamana could be suggested. The advantages are anamastita doshagre langhanam doshapatanam jvaragnam deepanam kamsha ruchila aghavakarkam. By langhana, the dosha patana would occur. The pathological these changes would be corrected by themselves. Homeostasis would occur and the patient would become normal. It increases the appetite and the taste appreciation, and the patient would feel light as it. Sasta martha venmutram kshutripasa asaham lagum prasanna atmendriyam kshamam naram vidyatsulangiram. The evidences of a proper langhana is patient should be able to pass the stools and platters clearly, easily, and the patient should have good appetite, and appetite to such an extent that he cannot tolerate further. And patient should feel light, should have a clear sensory organs, sensory perception should be normal, and the patient should have weight loss. That's a sign of sulanghana, proper langhana. If the atilangana, langhana has gone beyond the limits, in that condition, balakshayaham, trisha, shosha, tandra, nidra, brahmaklamaha, upadravasya, swasadhyaha, sambhavanti atilangana. If the langhana or fasting is more than what's necessary, then there could be a severe balakshaya, that debility, excess of thirst, even emaciation could occur, sleep could be affected, and or there could be excess of sleep even, and the complications like breathlessness may occur. Deepanam kapha vichchevi pitta vatanulomanam kapha vata jvarartebhyo hidam mustambutrachidam taddi madhavakar dosha sotasam sheetam anyatha sevamanena to yena jvara sheetena vartate. In all the patients during the langhana, patient may have to be given warm water, and the warm water has a deepana property, and it reduces the kapha, and anulomana, it facilitates the proper movement of the pitta and vata, and hence in kapha vata jvara, warm water is always suggested, which can help in dissolution of the doshas. Cold water is contraindicated in all the conditions of fever. Cold water is contraindicated because that can increase the jvara. Pitta madhya vishoktheshu shitaram pittakai hirsutam gangeya nagara ushira parpata udityatam danehi. Even in case of pitta jvara, though the cold is suggested, instead of giving cold, it can be given in the form of a shita dravya prepared kashaya, like nagara, ushira, parpata, these are added, and that cold water could be given. Deepani pachani lagvi jarartanam jarapaha na kala hita peya yatha swam pachani krita. Once the patient's langhana limit is over, or during the langhana, if the patient, to sustain the patient, a peya, light ganji, or the liquid portion of the gruel has to be given, processed with some deepana pachana dravyas. ಬಹುದೋಷಸ್ಯ ಮಂದಾಗ್ನೇಃ ಸತ್ರಾತ್ರಾತ್ ಪರಂ ಜ್ವರೆ ಲಂಘನ ಅಂಬು ಯವಾಗು ಬಿರ್ಯಾದ ದೋಷೋ ನ ಪಚ್ಯತೆ ತದಾ ತಂ ಮುಖವೈರಸ್ಯ ತೃಷ್ಣ ಅರೋಚಕನಾಶನೈಃ ಕಷಾಯೈಃ ಪಾಚನೈಃ ಹೃದ್ಯೈಃ ಜ್ವರಗ್ನೈಃ ಸಂಪಾದಯೇತ್. Specific Jvaragna Aushadhis are indicated if the patient doesn't have a resolution of the fever even after 7 days. After 7 days of Langana, if the patient doesn't have a resolution and if the patient still has an anorexia, thirst or arochaka etc., in such conditions, Kashaya Dravyas, Atana and Kashaya Hridya and Jvaragna Aushadhis can be given. Panchamuli Kashaya and Pachanam Pavanajvare सक्षौद्रं भौतिके पैतिके मुस्ता कटुक इंद्र यवैः कृतं पिप्पल्यादि कषायं तु कफजे परिपाचनं द्वन्द्वजेषु तु संसिस्टं दद्यात्. Now in the kaphaja vataja jvara panchamuli kashaya has to be given. Pittaja jvara mustaka indra yava prepared kashaya with kshaudra with honey has to be given. Pippल्यादि kashaya is in case of the kaphaja jvara. And यथा अथ विवर्तेत पीताम्बुः लङ्घितो भुक्तो अजीर्णः क्षीणः पिपासितः. Patient after langana, and if the patient still has ajirna and becomes weak, that is considered to be difficult to be treated. That's about the basic line of treatment. We will continue in the next session from now onwards about the variability of the treatment protocol in different conditions. We will continue the next session. If there are any questions, we will try to answer. Right, there are no questions now. Right.